Dr. Nada, when parents require surgery for their children or their babies, typically the first thing they do is they have to figure out which hospital to go to. Do you have any advice on parents in Malaysia?
That's a very good question. That's a very common way in which parents approach how to take the child for surgical care. But let me introduce a different way of thinking and different way of approaching this issue. You need to think about how you like your surgery for the child to be done. And secondly, who does it? And finally, which hospital or where you need to take the child to. Let me explain that in detail. One, you need the best and also the most current way of surgical approach, which I think currently is the keyhole method. And then you need to look for a surgeon that is experienced enough to provide that for your child. And if that's available in the hospital near you or wherever that's suitable for you, then you take your child to that hospital.
So it's very much how should the surgery be performed, then who should perform that surgery, and finally, where should that surgery be performed? Is that correct?
That's right.
So can you tell us a little bit about the how in terms of what kind of surgery should be performed?
So the various options are keyhole surgery or open surgery. The keyhole surgery involves very small incisions, 2 or 3, onto the tummy or chest, and doing the operation into the abdomen or chest with very minimal access, very minimal pain, and significantly improved recovery. The open access, as you know, is a bigger cut. The recovery from the muscle injury and the skin injury takes slightly longer. So the approach that most advanced centers in the world opting for keyhole surgery as the primary way of providing surgery for children.
And why is choosing the type of surgery so critical?
I think if you're looking for the best and you're looking for the most advanced form of surgery, and the reason why there's advancement is because we're providing better and better care. And that's how medicine progresses. So we're looking for better, less invasive, and quicker recovery. And with that advancement, we need to provide that for every child, if possible, anywhere in the world.
So as a parent, once I figured out that keyhole surgery is what I'm after, what's the next step?
Once you identify that the child has a surgical issue and keyhole method is your option, then you need to identify whether there is a surgeon who is experienced enough to provide that kind of surgery. Local hospital may not even have a pediatric surgeon. So there might be a general surgeon who's providing general surgical care, which is not ideal. A child must have a child surgeon. Preferably, if the child requires surgery in the abdomen or chest, a surgical approach of keyhole or laparoscopic surgery or thoracoscopic surgery is so much better for a child, for his or her recovery and long-term issues such as scarring and muscle deformity and so on. A pediatric surgeon only deals with children, and the physiology, the psychology, and the anatomy of a child is completely different from the adult. And a child surgeon is specifically trained to deal with the child, and the responses to surgery to a child is completely different from an adult patient. So I think now that the numbers of pediatric surgeons is increasing, especially in Malaysia, there's so many more pediatric surgeons available for parents to choose from. If you have a trusted pediatrician who is referring your child to a pediatric surgeon, then inform the pediatrician that this is a kind of surgery that you like for your child, which is keyhole surgery, and ask whether the pediatrician can refer you to a surgeon who offers keyhole surgery. Secondly, if you're doing search for yourself on the website or online, then the key words that you need to put in, things like keyhole surgery, minimally invasive surgery, or laparoscopic surgery, or thoracoscopic surgery, depending on where the surgery is involving in the child's tummy or chest. And once you identify that there are surgeons who are providing that service, then when you go to visit that person, then you ask them for the experience in that kind of surgery, whether they have experience in doing keyhole surgery, what kind of numbers they've done, and how confident they are in performing such surgery. I think what's important for the outcomes for children is how it's done. and not so much where it's done. I think if the surgeon is well experienced, the outcomes for the child is pretty good. So in terms of the recovery, in terms of the care for the child, I think the surgeon comes first. And doesn't matter whether they operate in a small hospital or a big hospital. I often operate in various different hospitals, whether it's big or small, and the outcome should be good in an experienced hand.